Good afternoon, and thank you so much for joining our webinar from Advanced Specialty Care. I am Carolyn Ripp for Advanced Specialty Care. The webinar today is Facial Rejuvenation, and our presenter is Dr. David Goldenberg. And before he begins, I'm going to just talk a little bit about Dr. Goldenberg. Dr. Goldenberg is a plastic surgeon and cosmetic surgeon, as well as a hand surgeon at Advanced Specialty Care. Their offices are in Danbury, Norwalk, New Milford, and Ridgefield. He's also section chief of the plastic surgery subsection at Danbury Hospital in Danbury, Connecticut. He received his medical training at New York Medical College in Valhalla, New York, and he is board certified by the American Board of Plastic Surgery and the National Board of Medical Examiners. He's a member of the American Board of Plastic Surgery, the National Board and Connecticut Boards of Medical Examiners, the American Society of Plastic and Reconstructive Surgeons, the Fairfield County Medical Association in Danbury, and the Connecticut Medical Societies. He's also part of the Connecticut Society of Plastic Surgeons, the Northeastern Society of Plastic Surgeons, and the American Society of Aesthetic Surgeons. And Dr. Goldenberg, I'm going to hand it over to you now.
Great. Thank you very, very much. Thank you very much for that wonderful introduction. I certainly have not wasted any time joining societies, it looks like. I'm a member of all of them. Anyway, what we're going to talk about today is facial rejuvenation, one of my favorite topics. And we're going to start out by saying one of the most important things, if you take anything away from this talk, it's the fact that not every new procedure is a good procedure. Plastic surgery, is particularly cosmetic surgery, is a gigantic topic. It's in every magazine. It's on many, many TV shows. You see it over and over and over again. And there's a huge business devoted to providing cosmetic surgery services. The problem is that every now and again somebody proposes a new procedure, and the public is unable to tell the difference between something which is new and good and something which is new and bad. So the reality of this is that if you're contemplating having cosmetic surgery, you have to associate yourself with a plastic surgeon who is not going to get on the bandwagon with new procedures, which aren't necessarily good. So several examples of these, for example, would be smart lipo and different kinds of liposuction modalities, which have become very popular and actually don't work too well. So in general, if you're thinking of having cosmetic surgery, make sure that your plastic surgeon is board certified and is familiar with all the techniques, not just the new ones. So facial rejuvenation in general these days includes discussions about Botox, different kinds of fillers, possibly brow lift for the aging forehead, possibly nasal surgery, eyelid surgery, and facelift surgery. So we'll be talking about these item by item and give you some useful information if you're thinking of doing these types of procedures. So Botox is the first thing we're going to speak about. Botox is the #1 non-surgical facial rejuvenation technique used in the United States. Millions upon millions of doses of Botox are given every single year to both men and women. It's a safe drug. It's a standardized drug, and it does what it's supposed to do, which is one of the reasons why we like it so much. Botox is very, very good for treating this part of the face, for treating the so-called 11s, and in weakening the muscles that cause frowning. Botox can also be used in this portion of the face to raise the brows. It can also be used out here to treat the crow's feet. Some plastic surgeons use it here to raise the corner of the mouth in some cases, and some plastic surgeons even use it on the neck to reduce neck lines. So this is how Botox works. Basically, it's an injection, and it's made up, Botox material itself is made up of natural and purified protein. It relaxes the muscles by blocking nerve impulses. Once the muscles are at rest, the skin becomes smoother, creating a more natural and relaxed appearance. The general concept here is that the lines that are found here on an individual's brow are caused by muscle pull in this direction. That is, the muscle pulls horizontally and creates vertical wrinkles. So the way Botox works, the way this chemical works, is by weakening the muscles that pull this skin together, thereby making those wrinkles go away. This is the most common place where Botox is injected. Usually it's a series of injections that may not necessarily be in this pattern. A good plastic surgeon who does this will customize the Botox and make sure that it's given where the individual needs it the most. So here's some before and after pictures of Botox. This individual, fairly heavy muscles, again pulling from here and here in this direction to create this wrinkle, and here's Botox afterwards with a lessening of the wrinkle. Sometimes the wrinkles go away completely, sometimes they don't, and also another an added benefit of Botox is the fact that the brow may come up as well. The important point to be made about Botox is that it's a customizable medication. It's best given in the hands of people who do a lot of Botox and know how to use it and know how to customize it, rather than following a standard pattern. So here's a man showing what effect in men Botox can have. Again, vertical lines that you see here, heavy brow, very thick muscles. You can even see the body of the muscle. Botox is given, and here you have a more relaxed view. Here's another one showing a patient trying to activate her muscles. This is by frowning, and you can see all the corrugated muscles that work in here. Post-Botox, a notable relaxation of the muscles. So again, Botox, safe, reliable, customizable, and repeatable. Botox lasts for about 4 months. If somebody individuals are interested in doing it, that means usually 3 times a year Botox is given. It's safe. Occasionally an individual will get a headache with it. Sometimes they'll get some bruising, but generally it's very, very well tolerated, very, very standardizable, and safe to do. The next topic I'd like to talk about are fillers. There's been a revolution in the use of fillers and the different types of fillers. Fillers are different than Botox. Fillers are basically used to directly fill a wrinkle in the face. They do not work by changing the muscle pull. So individuals, patients frequently come in and say, I want fillers here, and I say, no, you want Botox here, you want fillers here. And fillers are most commonly used in this fold here, the so-called nasolabial fold, sometimes at the corner of the mouth, sometimes in other individual wrinkles on the face. But the point of fillers is that they're used to directly fill a wrinkle rather than weakening the muscle that creates the wrinkle. So various uses for fillers. Here's a long list, but this is one of the most common ones, is occasionally on frown lines between the eyebrows that do not respond to Botox, smoker's lines, vertical lines on the mouth, marionette lines at the corner of the mouth, and other places where they can be used. The important point to remember is that fillers are not a substitute for Botox. We frequently do them together, and we get patients on a schedule. We basically see an individual once a year for fillers, and then 3 times a year for Botox if they're interested in doing those types of treatments. Most Botox and fillers tend to be used on younger patients. That is individuals who cannot or do not want to have surgery, and both the use of fillers and Botox are an excellent way of temporizing and preventing surgery for years. And the reason for that is that they work. They actually do remove the wrinkles, fill the wrinkles, and give a more youthful, rejuvenated appearance without surgery. Now, Restylane is one type of filler among many types of fillers. This slide says it was recently approved. Actually, it's been approved for several years. Very popular, one of the most common fillers that are used. Unlike the older type of collagen that we used, Restylane is actually created in a lab. It's made of a particular type of a gel known as hyaluronic acid, and it's used for the fold between the nose and the lips, sometimes the lips themselves, creases, forehead, and areas of that nature. 6 to 9 months with Restylane. I think it's better than that. I think it lasts about a year. But again, Restylane is one of those very common fillers that we use. Here are some examples, before and afters, which show what Restylane can accomplish. The filler itself is injected in these folds and then improves the appearance by filling them and smoothing out this aged look. A particular note is this particular individual, which is a very good illustration of the fact that many, many people are not symmetric. Sometimes the folds are deeper on one side than the other. Well, clearly the solution in that case is to give more filler here than here. The other important point to make about fillers in general, both Restylane and others, is that it may not be necessary to obtain complete correction of the wrinkles. Sometimes the best objective, some individuals like this, is to improve the appearance, not necessarily to make these wrinkles go away. Remember that all cosmetic surgery procedures have to be age appropriate. What we don't want to do is create a very, very youthful looking mouth in an individual with aged eyes and aged jowling. The idea is to make things appropriate for the individual who's coming before us. Here are some more pre-ops and post-ops of fillers. Again, improving the nasolabial folds, not necessarily getting complete correction, but definitely improving the situation. An important point to be made about fillers is that it is all related to the amount of volume that's given. If an individual of this nature who wishes complete correction, we can give 2 cc's of Restylane and get complete correction, completely fill out these lines, but it may not be necessary. And a good conservative plastic surgeon is going to aim for an aesthetic age-appropriate look rather than an inflated, inappropriate look. Radiesse is another type of filler that's used. It lasts longer. It's made from a different type of a material, but basically and fundamentally, other than the time that it lasts, it's used for pretty much the same indications as Restylane is used. Radiesse treatment, here are some pre-ops and post-op treatments showing much the same result. A very good question that comes up with the use of fillers is how does the plastic surgeon decide which filler to use? And the answer really lies in longevity the patient wishes to obtain, how much money they want to spend, because Radiesse is more expensive than Restylane, and also the type of the wrinkle. In many situations, a wrinkle of this nature may require a more deeper correction. In some cases, the wrinkle may require a more superficial correction. So the way the plastic surgeon decides which filler to use is, what are we correcting? How much correction do we want? And that is done in a discussion with the plastic surgeon. Not all fillers are appropriate for all patients, and not all fillers are appropriate for all indications. These are some other examples of fillers for various individuals. Again, obtaining nearly complete correction in this individual, but not necessarily complete correction. Again, filler correction is determined by which filler is used and how much is used. The third filler that is in very common use is Juvéderm, which again is a hyaluronic acid. It's a clear gel, which, as the slide says, is a natural part of your skin. Again, adds volume and hydration, and it corrects the same sort of wrinkles that you would with any of the fillers. It's injected in a certain place in the skin, and it corrects certain types of wrinkles, but of course not others. Results for Juvéderm basically last about a year. And again, people are interested in fillers and Botox. Usually we like to get them on a schedule so that they are, when their Botox is wearing off, they're coming in for a redo of their Botox, and when their fillers are beginning to be reabsorbed, they get another treatment and keep a youthful look. Let's talk a little bit about brow lift as a surgical method of facial rejuvenation. We covered Botox and fillers, but brow lifting is a type of a surgical procedure for individuals in whom Botox will not work, and the brow has descended to the point where it's not recoverable using Botox. Basically, brow lift is a surgical procedure. An incision is made at the hairline, and the brow is lifted, usually from beneath the skin surgically, and fixed in that place. We'll go into some more detail about that, but recovery takes about 7 to 10 days. There's some bruising, there's some stitches that have to be recovered, but it is usually very effective in correcting the problem. Essentially, the problem with women who require a brow lift is that there is hooding of the skin over the eye, and that this distance between the brow and the eyelid skin has become too short, leaving a heavy-lidded appearance. Through a brow lift, that distance can be increased from this distance to this distance, again through an incision up in the brow line, which lifts the brow off of lifts the brow off of its abnormal position and raises it to where it should be. In concert with that, occasionally, some women will have some of the upper eyelid skin removed as well. Very good question is, when does a plastic surgeon know when to do upper eyelid surgery or when to do brow lift surgery? And the answer is, it depends on the position of the brow before the surgery, of course. In individuals who have a normal brow position and extra skin, we would merely remove the skin. In individuals where the brow position itself is low, the brow would be lifted and then skin may be removed as well. And that's how we make that. Distinction. Now, rhinoplasty is not generally considered among procedures of facial rejuvenation, but it does come up occasionally because as people age, the tip of their nose tends to droop, and because of some of the loss of volume in the upper lip, they would benefit from having the nasal tip raised and have the nasal shape redone. The procedure is an outpatient procedure. It's done under general anesthesia, and basically the point of it is to change the underlying structure of the nose so that the cartilage is a better shape, the tip of the nose is better shaped, and it's less drooping. Recovering from this type of surgery is fairly quick. Stitches come out at about 6 to 7 days. There may be some packing in the nose. There may be some bruising. Occasionally, it's necessary to break the nasal bones to get a better shape, but the recovery usually proceeds fairly uneventfully. And basically, the goal, and this happens to be a young individual, but an older individual, it's also possible. The purpose of the surgery in this particular individual was to raise the tip of the nose and then reshape the cartilages to get a better looking nasal tip. The photographs aren't exactly comparable because this is more of a close-up, but the idea is to reshape the tip, take away these bulky cartilages, and generally improve the appearance. And in this situation, you can also see how the profile was improved. That is, with reducing the nasal hump here, raising the tip, and improving the general overall structure of the nose to be more aesthetic and more balanced. So eyelid surgery is a very common procedure, one of the more common procedures performed in the United States. The average age, to kind of nail that point, the average age of eyelid surgery in the United States is 48 years old, and it's a full decade before facelift surgery. People have a good question to ask is, why does eyelid surgery precede facelift surgery by a decade? And because we get many questions from patients about what is the appropriate time in my life to perform the surgery. The reason why eyelid surgery is generally performed about a decade before facelift surgery is because the eyelids are the first anatomic structure on a face to age. Because women, both men and women, develop excess skin of the upper eyelid. They may develop some descent of the brow, but the first sign of aging in a human face is generally the eyelids. And this precedes the creation of jowls and extra neck skin by about a decade. So again, average age for eyelid surgery in the United States is about 48, and facelift surgery is about 58 or 59 years old. Eyelid surgery is a straightforward plastic surgery procedure. Before the surgery is performed, the surgeon meets with the individual, of course, and then outlines exactly what the surgical plan will be, exactly what's going to happen. Generally, eyelid surgery is done under sedation type anesthesia. It's not done under general anesthesia. Individual gets an intravenous sedative and then local anesthesia to control the pain. The procedure in most cases is to remove extra eyelid skin and then sometimes fat, which is protruding through the skin itself. Recovery from eyelid surgery is fairly expeditious. Stitches are usually removed about 5 days after surgery. There's bruising for about a week to 10 days, and it's a relatively risk-free surgery with few complications. There are different methods of doing the surgery, but in general, most surgeons in the United States, most plastic surgeons in the United States have a straightforward surgical approach at the edge of the eyelid itself, removing extra eyelid skin from the lower eyelid, some from the upper eyelid skin, and then removing the fat. So eyelid surgery, here is an individual with bothersome fat here and here, who also has extra eyelid skin of the upper eyelids. Now, she has a little wide-eyed appearance here, which is probably more related to the photography, but the point is that the upper eyelid skin is now cleaned up, and as much of this fat in the medial compartment, that is this middle compartment, can be removed. You don't see any visible scars in this individual because the scar is in the fold in this crease. So when the surgeon is performing the surgery and is indicating where the incisions will be, this is done carefully preoperatively to make sure that when the incisions heal, there are no scars and they're completely invisible and hidden in the folds. So the next surgery I'd like to talk about is facelift surgery. Again, to go into some detail about it, facelift surgery again is about a decade later than eyelid surgery. Typically, women in their late 50s and early 60s. The facelift surgery has evolved quite a bit in the last 15 or 20 years, and most plastic surgeons who are performing facelift surgery are using a structural approach rather than just treating the extra skin. Most of the surgeons these days are performing this facelift surgery by also strengthening the structure beneath the skin and performing a surgery that improves the support of the skin so that the skin doesn't descend again. The procedure itself is performed in some cases under general anesthesia, in other cases under local anesthesia with sedation. Surgery takes anywhere between approximately 2 hours to 4 hours, depending on exactly what has to be corrected, the surgeon, the anesthesia, and things of that nature, but it's rarely longer than 4 hours in length. Recovery from facelift surgery is fairly quick. There could be some bruising of the skin, there can be some swelling afterwards, stitches come out at 7 to 10 days, but the final effect is basically designed to improve the aesthetic look. So to go into some detail about that, there are 2 incisions that are used in facelift surgery. One is the incision that goes from the hair, just behind the hairline, in front of the ear, under the earlobe, and then into the back. This is not an incision that everybody uses. There are many, many variations on it, but the general idea is that the scar heals imperceptibly in front of the ear because it's in the crease, and the rest of the incisions are hidden in the hairline or in the hairline behind the ear. In addition, not shown on this slide, is that very frequently an incision is made beneath the chin to treat the extra soft tissues. The point of the surgery is to pull the skin back in this direction along the appropriate line, and then to support the structure in this area, right down in here, to make sure that there's good structural support for the skin once it has been moved. In addition, the incision that's below the chin is designed to make sure that the extra fat that is beneath the chin can be removed, and also to make sure that any neck folds are corrected, and so that the resulting curve of the skin is smooth. The idea behind the surgery is to restore a youthful line, that is to rejuvenate the face, give a youthful line to the jawline, and to eliminate the extra skin beneath the neck, to eliminate the jowl, in many cases to help with the deep fold between the nose and the lips, and even to improve some of the skin contour behind the eyes. And that would be the general role of surgery, and that would be the general way that it's approached. So here's a typical individual who wishes to have this surgery. So here are the things we want to correct. The first thing we would want to correct is this heavy cheek appearance in here, and then correct this curve, which is created by descent of these tissues downward. In addition, with age, she's developed extra skin beneath the chin. So the purpose of surgery, again, is to translocate, to move the skin back and up in this direction to reduce the fullness here, reduce the fullness here, and reduce the skin here. And that would be the goals in this individual. In addition, you can see her jawline is interrupted. Instead of having a smooth contour, she has a double contour here and here. And this shows what we would expect to achieve with the surgery. Again, a smooth line, a youthful smooth line from ear to chin, angular fold underneath the chin with no fat and extra skin, a correction of the jowl with complete correction of the jowl, and then an improvement of the descent of the soft tissues here. And then, again, this is all done through incisions in the back here to hide them as much as possible. The three-quarter view shows what the ideal result would be with a correction of the skin in this area, correction of the jowl, correction of the soft tissues, giving her a much more youthful look. And this is a little error here. I have to admit, this is a problem where the earlobe is being pulled by the skin flap, but we don't do that anymore. That's since been corrected, the technique of not having that any more than that. So now we have some opportunity for some questions.
Yes, thank you, Dr. Goldenberg. This is Carolyn again. There is an opportunity and some time for some questions. If you look in your GoToWebinar, you can type your questions in the questions drop-down. And I actually have one question here. It says, how long does a facelift result last?
That's a very good question. In general, in my practice, I've never repeated a facelift sooner than 10 years. And there's a couple of points to be made about that. The first thing is that the major correction from that kind of facial cosmetic surgery is dramatic and complete. And almost all of the extra skin and the extra folds are repeated in the first surgery. With continued aging year by year and decade by decade, some of that skin stretches and some of the original deformities recur, but they never get as bad as they were originally because the skin doesn't regrow. It just tends to stretch with time, and of course gravity continues doing what it does. So redo facelifts for very infrequently sooner than 10 years. Redo facelifts generally have the same result, that is, you look the same as you did after your first facelift, but it tends to be a smaller operation. And the reason is because the skin has already been moved, and the purpose of the second operation is merely to improve the situation without redoing the whole surgery. So the answer is facelift surgery is about 10 years and frequently more than that.
Great. Thank you, Dr. Goldenberg. As I said, there is an opportunity for questions. If you see in your GoToWebinar dashboard, you can type in a question under the questions drop-down. And actually, I have a question here. It says, can you use a filler or Botox for under the eyes?
That's a very, very good question. Very good question. One of the last frontiers in plastic surgery is the eyelid skin, lower eyelid skin specifically. And let me address some misconceptions and sort of talk about it for a bit. The problem with eyelid surgery, it is the most particularly lower eyelid surgery, is that it is extremely, extremely thin. And because it's so thin, it shows some of the blood vessel structures beneath. That is why eyelid skin, lower eyelid skin, develops dark circles. It doesn't have anything to do with pigmentation in the skin. It doesn't have anything to do with extra skin. The reason why lower eyelid skin looks dark is because it's very, very thin, and it shows the actual blood vessels and the blood structure beneath. So the problem is that skin cannot be removed. It can't be surgically removed except for small quantities of it. So it needs to be treated a different way than surgery. Generally, the best way to treat lower eyelid wrinkles, for example, is through resurfacing. Either laser resurfacing or chemical peel resurfacing is the only way to really take care of the textural problem, that is the texture of the skin below the eyelids. fillers are can be used for the deep fold underneath the eyelids. That is the fold that goes from the inside of the eye near the nose out to the side. Fillers can be used for that fold, but that can have some problems. There can be some persistent swelling and some other areas, other problems like that. So it's not really used commonly for that indication. But the answer to the question is that Botox will help out towards the sides, towards the crow's feet. Fillers will help the deep fold that's found underneath the eye, but the actual smaller eyelid wrinkles themselves are really best treated with chemical peels or some other method that treats the texture of the skin rather than tries to fill the wrinkles with using a filler or Botox.
Great. Thank you, Dr. Goldenberg. A few more questions. One is about a brow lift. It says, does a brow lift pull other stuff up? When I pull up from the hairline now, it feels like it might pull up sagging skin.
It does. It does. A brow lift really can help with not just the lateral brow, that is the side of the brow that has descended. It also can help with the central brow, that is the area between the eyebrows. So the answer is yes. It does pull up some extra skin. It can pull up some extra skin next to the eyelids and themselves. But the main structure is really geared towards raising the brow from the middle part of it all the way to the outer part of it. That is from the the inner part of the eye to the outer part of the eye. It's designed to raise that sometimes by 4 millimeters, 5 millimeters, that much to get the brow off the eyelid, so your eyelid appearance is brighter without having that heavy appearance.
Okay, great. I have a couple of facelift questions coming up. One says, does anything other than a facelift help the jowls?
Yes. As a matter of fact, there are some things. And in fact, what I have been doing with fillers is that I've been filling the actual depression that the jowl creates. In other words, particularly on younger women who are just beginning to get some jowl descent, and they're starting to get a break in that line from the chin to the cheek. Very frequently, a way to camouflage that and improve the appearance without surgery is to fill that with a filler using a half a cc of filler, or let's say Sculpture or something of that kind of a product to visually hide that groove. Now, another thing that can be done on women who have fairly healthy skin and fairly healthy and elastic skin is to do some liposuction of the jowls as well. And that beneath the chin, we can make a small incision and basically use a liposuction cannula to pull, that is a small metal tube, to pull out some of the extra fat of the jowl itself. And if the skin is elastic, if the individual has good elastic skin and good healthy skin, that skin will stop hanging. It will actually be emptied carefully, conservatively, and this way it'll improve the jowl without doing a facelift. So the two ways of correcting jowls other than surgery, that is a facelift, would be either fill the groove, obscure it with some filler, and sometimes liposuction of the jowl itself to reduce its volume and make it less prominent.
Okay, well, another facelift question. How much does a facelift cost? Give a starting point it asks for.
Well, the I would say that most facelift prices, the lowest price you could probably find would be about $8,000 in some areas. But the way cosmetic surgery pricing works is probably unlike a lot of other other things you might buy. The reality is that if you go to a big city and you go to a big name, people who have been on television or what have you, you'll pay probably double that amount and even triple that amount for a facelift. Most suburban cosmetic surgeons who are practicing, near a major metropolitan area generally have more reasonable prices, and I guess that's part of the way one of the ways that you shop for your plastic surgery. It's not a good way, but some people do shop price. So, any other questions?
Yeah, I do. There are. There,
Go ahead.
I'm going to combine, it's another facelift question, and I'm combining them. One asks, how long does it take before you can resume regular daily activities after a facelift, and can you exercise afterwards?
Sure. Well, daily activities, if you use that term daily activities, that covers a wide range of things. I mean, some people have very sedentary lifestyles, and other people are marathoners. So the answer to the question is, to be more specific, is that immediately after a facelift, for at least 7 to 10 days, most individuals really need to be quiet and at home. There's several reasons for that. First of all, right after surgery, they're recovering from anesthesia. There are dressings that have to be taken care of. There are ointments that have to be used. Stitches have to be removed, and there are problems that need to be addressed that ordinarily we address as they come up. So real immediate recovery from a facelift is really 7 to 10 days. Going back to light exercise at that point, that is walking, light weights, are things that are possible. 10 days, let's say 2 weeks. Real hard exercise, again, marathoners, people who exercise, an hour a day, those sort of things, people using a lot of their core and a lot of the head and neck muscles, that's out to, 3 weeks, 4 weeks before you're really back to those kind of exercise. But daily activities, if you're just going to be around the house and maybe, light activities and what have you, usually by a week after surgery, you can usually do most things. But remember, the important thing about these kind of surgeries is that people are going to notice a difference. They're going to notice a difference, and they're going to notice that you've had surgery. The longer you wait to go in public, the more improved you'll look. So right after surgery, a lot of women choose not to be in the public eye. So again, 7 to 10 days of really taking it easy. Say 10 days to 2 weeks of light activities, and then 10 days and on 2 weeks, 3 weeks before you're really back to full activities. Normal full activities takes at least several weeks. Go on.
Okay, great. I have a few more. We have a little bit more time. So when I get fillers and Botox around my smile lines, it pushes stuff down around my chin area, and I do not like that side effect. How do you deal with that?
Well, I'd of course have to see it to really understand what that means. But let me answer it in this sense. All of these products, Botox and fillers, have consequences. And what I mean is that Botox that is overdone will give you a frozen-looking face. There'll be no wrinkles. There'll be very little animation. And in fact, Botox can even create new wrinkles. And paradoxically, the reason for that is that muscles that are trying to overcome the weakness will work overtime. So sometimes some women will get new wrinkles that they didn't have before, which can be very, very upsetting, and usually it goes away, of course. Fillers can also have problems. That is, they sometimes can slightly change the color of the skin because they change the thickness of the skin. They can sometimes be pushed by injection into other parts of the face. And these are small volumes. They don't really cause any really major problems. But generally, the surgeon who's doing the filler, anybody who's doing the filler, wants to put that filler in a certain place. It is designed to be used in a particular specific place. If it goes someplace else, that's a problem, and needs to be addressed. But the way we deal with these things, the way we deal with them in our practice, the way I deal with in my practice, is that most new patients who have either Botox or filler for the first time are seen 2 weeks after. We pull up their preoperative photographs, we look at them, and then we either see, we see what happened. Did the Botox do what it was supposed to do? Was it effective? Did you have enough, too much, what have you? And it's the same thing with fillers. So the overriding point here is that if you're not happy with your fillers or your Botox, it could be because your plastic surgeon or whoever did it didn't get enough feedback, didn't see you afterwards to really see what the effect was. In my practice, if I get an effect I didn't like or I didn't get enough effect, we change the therapy. That's the whole point about good cosmetic surgery and good follow-up and good customization. The point has to be made that if you're not seeing your plastic surgeon at least the first few times after Botox, to make sure that it's doing what you're doing and that as your face changes, they're changing the dose, then you need to find somebody who's going to pay more attention. We don't treat every patient the same way, except to make sure that they're all seen afterwards and that we customize the approach.
Great, thank you. I have one more question before we run out of time. It says, if you don't use a full syringe of Botox or filler, do you save the rest for the next appointment?
You can save it for some time. There are some people who pre-mix Botox and save it. Some people who don't. So I know that's a squirrely answer and not a real hard and firm answer. The manufacturer, Allergy, who makes it, I believe, recommends that it is used when it is mixed. And there are occasions where we save it, but in general, it's not. But the way we handle these sort of things when there's a question is that there's nothing wrong with, we can draw up and we can mix a small amount of Botox and give it and see what effect it has, and then 2 weeks later mix up a little bit more. It's not uncommon, and it's not doesn't violate any protocol. The issue goes back to, if you're getting a standard dose of Botox every single time in every single place and you're not getting the result you want, it means that who's ever doing it is not customizing it appropriately and giving you the right dose in the right place. So we don't hold Botox for people. We don't hold it and save it for them because we learn after the first couple of times that we give it what's the best dose, what's the best place. So we don't really get into that situation because we try and customize it in the beginning. So we don't have any extra Botox, and we don't usually need any more. So that's how we deal with the issue. We see the individual back and make sure that they got the effect that they wanted with that dose.
Okay. Thank you, Dr. Goldenberg.
Okay,
I do have one more question. If we have time, we do have just one more minute. It says, can you use fillers in the cheek area to lift, and is it really effective?
Yes, yes, and yes. Cheek lifting is best done by a product called Voluma, which is, again, an injectable gel similar to both Restylane and Juvéderm, and that can be given in the cheekbones, which will lift the face subtly. Not a major effect, but it can lift it. And then Sculptra is another product that is now available, which can be given in hollow areas and can be used to improve volume. But it brings in another. But that question brings in another question. Is again going back to, how does your plastic surgeon know what to do, what filler to use in what place? So what it really goes back to is the original visit with the plastic surgeon, where the two of you sit in front of a mirror and say, what's the problem? What is really the problem? And there should be a give and take and a good open conversation discussing what the individual wants, what they want to see. And then the discussion about realistic goals, age-appropriate treatments, modalities of treatment, follow-up, complications, risks, and things of that nature. The most important point to be made about all of this is that every patient should have a plan. And the point is that the point of the plan is, let's figure out what the problem is. Let's look how old you are. Let's see what you need to fix anatomically. Do you need skin care? Do you need laser therapy? Do you need resurfacing? Is there a texture problem? Is there a filler problem? Is there a muscle problem? So at the end of your first interview with your plastic surgeon, if they're responsible and careful, should be a plan. And sometimes I say to the individual, look, you really should have your upper eyelids done, but you're not ready for lower eyelids yet. You can use some filler here, but Botox won't be helpful for you. On the other hand, you need some skin care, but you don't need laser. So, there should be a dialogue is the point. There should be a dialogue between you and your cosmetic surgeon. There should be a plan made that really addresses, what the problem is today, how we're going to correct it, and what are we going to do going forward, to reach the goal you want.
Great. Thank you so much, Dr. Goldenberg, and the questions were very awesome, everyone. I'm going to wrap up this webinar now. I want to thank you, and please, if you have any more questions or want to reach out for a consultation, please go to our website at ascdocs.com. And thank you all for joining us this afternoon.
Thanks, everybody.